UC health doctors want every doctor screening patients for long-haul COVID symptoms. They say it's so common and potentially so costly to our economy that it's critical to develop treatment. Reporter Larry Seward is outside UC Medical Center with details.
Researchers see chronic fatigue keeping people out of work, costing our economy billions, while people suffer through conditions hardly every employer considers legit. 35-year-old Hinda Stockstill started with mild COVID symptoms that spiraled into a cluster of constant fatigue, brain fog, fevers, chills, chest pains, migraines, weakness, numbness for 18 months and counting, throwing hair loss, and months when the former distance runner couldn't remember how to walk, brush teeth, or comb her hair. Hinda's long-haul diagnosis felt too heavy to bear without support.
I would have probably committed suicide. I was that depressed and that hurt and stigmatized. In the last 18 months, I've had 78 different medical visits, but they still don't have an understanding of what exactly causes long COVID and how to cure it or treat it.
UC Health's COVID Recovery Clinic wants change.
Prevalence is high, impact is staggering.
Center for Disease Control research say 1 in 5 Americans under 65 have long-haul symptoms. It's 1 in 4 among older crowds, though recognized as a potential disability by U.S. Health and Human Services.
I was tripping. I wanted to get out of there.
People like Cincinnati's Daryl Jones, who also battled fatigue, had to find new jobs.
Employers have found it difficult to accept short-term and long-term disability because there aren't clear diagnostic tests.
Swaying skeptics is a start, but with National Academy of Medicine research finding rising rates of chronic fatigue costing the U.S. economy $51 billion a year, doctors think the next big challenge involves better testing for long-haul symptoms.
How many people do we anticipate, because we had so much COVID, that will still be unable to join the workforce at 3 months, 6 months, or further down the road?
While the National Institute of Health director blogged about using artificial intelligence to cull health records to potentially identify people vulnerable to post-COVID conditions, UC's team of heart, lung, brain, kidney, and skin specialists want physicians screening every patient with questions about known long-haul symptoms. In time, they hope to give people like Stockstill everything they need.
We need love, encouragement, and support.
Larry Seward, WCPO 9 News.